well, welcome everyone. My name is Molly Smith. I am the Executive Director at Child Care Answers, and we're here just to share some data. We all love data, share what we found just in regards to child care professionals and their professional development needs. As we have continued working with professionals in various capacities and just listening, doing a lot of listening, professional development came up as something that they felt there was a gap. And so no better way to ask the professionals who need it what they are seeing and needing in their field. So that's where this data came from. So we'll get started here and talk through what we found. So really the survey purpose again is assess currently what their needs are, identify priorities, again, asking the childcare professionals themselves what their priorities are for future learning, and then inform future trainings, resources, and better ways to support. So I love the fact that lots of you here are also people who offer professional development. So that's exciting because this cannot be done in silos. We're going to have to figure out how to work together to make sure that we can support programs um, regardless of the auspice or across the state. So we put this together and started April 3rd and then realized, well, what a better way to get more folks information than the Indiana AAYC conference. So we kept it open longer than anticipated, but I feel like that was a good option. We obviously did promotion of the survey via social media, emails, partners, and then of course the conference. We ended up having 110 responses and about a 50% response rate. That just means a lot of folks at the Indiana AOAC conference were clicking on it or scanning the QR code, but then didn't finish it, and things of that nature. So it was about half response rate from those who started. So out of those 110 respondents, this is our makeup. So obviously a majority of these were owners and directors, and some of their comments and responses were and they included information about their staff, not only in the open-ended areas such as this is what I need as an owner or a director, but this is also something that would be helpful for my staff. We have administrators, lead teachers, and assistant teachers, and then we did have one ECE specialist. The majority of these were respondents who preferred training in English, but we did have some other requests, five for Spanish, three Burmese, and one Haitian Creole. So I think that is something we need to consider when promoting different opportunities and how can we get these in the hands of people regardless of what language they speak. County responses. Again, we had thought about this was just something we assumed would be more central Indiana. Just that's where our biggest impact here is at Child Care Answers and people who know who we are. But other people were participating and it was open to anyone. So again, may not be a large response from specific areas, but I do know that we were willing to take information from regardless of who responded. Obviously, Marion County is the biggest county represented, but you can see others here. And I think this makeup also can give us some information. So if you're from Northern Indiana, Southern Indiana, or outlying counties, we are happy to share those specifics with you. Obviously, we won't share program or detailed information about the person who responded, but if you are from Clinton County and you want to know what that one response was, we are happy to share that data. So if you have specifics to exactly what that response was, you can throw your request in the chat and we'd be happy to send that to you after the information session today, because I do know that is extremely helpful to know those specifics for that county. So please do not hesitate to ask for that. So the type of programs that responded, majority were unlicensed registered ministries, 34 for licensed family childcare homes, and then centers. We did have some school-based programs, exempt programs, one before and after care only, and then two others because again, we did have some ECE professionals respond as well. So that is the makeup of those that responded. And so professional development sources, the first thing is where are you getting it currently? Where are the professional development opportunities? And so the majority is online. And the majority of that is through iLead. That is where the majority of folks had put. Some people said, iLead plus care courses or iLead plus Brightwheel. So I think that that's important to note, but the majority of folks said, 72% of those respondents had said that they get those through iLead. ECE partners, people who are showing up and saying, we know that there is a gap in professional development, let's help. And so United Way, Indiana Youth Institute, Early Learning Indiana, and Indiana AUIC. Again, there were some folks at the Indiana AUIC conference, and so that was also some professional development, so that was to be expected. Then we had some in-house, so we have folks who have teachers on their team or directors, assistant directors who have an expertise, and so they are doing in-house trainings. Local opportunities, these are just providers who are finding things that are sourced locally, maybe through, excuse me, community foundations or other avenues that are not directly early education driven organizations, but they may be hosting them. And then, of course, we have our folks who are using Ivy Tech and other college courses to get their professional development. Here's a quote from one of the licensed family childcare homes in Northern Indiana. I now have to travel almost 2 hours for any in-person training. I have no idea who is supposed to be our support members and affiliates.
Yep.
I feel like we are once again just out here by ourselves with more and more changes being made to make home childcare no longer possible. Think about folks who are interested, they want to grow, but they have to travel 2 hours for that in-person training. That limits their availability to grow in that role, which then also affects the children and families they serve and the staff that they have. So we included that quote because that was a sentiment that we found through several different people who had filled this out. Another part to this is their budget. We know that professional development is not always in everyone's budget, and to pay for trainings can be feel out of reach. So we did ask this question. As you can see, there are over half of those responding say either unsure or they have $0 budgeted for this. As we all know, budgeting concerns and constraints have been a challenge across this last year, but even longer. And we felt this was something helpful for us to inform anyone who is looking to provide professional development. We did have some who have this larger budgets built in. Most of those are coming from centers. But again, it still is the minority of all programs have a budget built in for professional development. And then we did have an owner of a program say that there's no sense in training since we'll be closing due to kids. They felt like training was really a waste of time right now and resources that they needed dollars and efforts to be put in other places. And so for me, it's important that we hear their frustration and what can we do about that? I don't know that we all have dollars to be able to feed right into programs, but this is a sentiment that we need to lift up on their behalf and reach out and see what can be done, as that is the frustration right now. So, some key findings. The frustration and uncertainty really came across in funding, access to resources, support, and then the future of the CCDF dollars. I don't know that any of those are a surprise to anyone, but this is, this plays into their professional development, the amount of time that they're putting into it, the where do I go to find professional development, and is this their top priority? There was also the sentiment of lack of communication. Is it clear? Is it in a way that's friendly to childcare professionals? And what are the options? Where do I go for answers? We know that there is a network of those of us in early care and education who want to connect, but not everyone is part of that network. How do we open this up and ensure that everyone who is interested and wants to attend professional development in whatever capacity has the ability to do that? And again, that goes back to that communication. So how can all of us work together to be able to support that? There are some positives. This is not something I wanted to leave out. It was disheartening as these comments came in and the information because I can feel the frustration that is there, but there were also folks who they're committed. They want their children to be in the best learning environments. They're committed to families, and a lot of this came back to the changes that they were making within their program and the way they were charging families so that they could stay in their program and continue working. They are committed to their staff, building morale and fostering that growth of that culture of growth. That came through. A lot of owners and directors are feeling the weight of this. And they don't know how to fix it. They're trying, but they need support. And then just the comment to their communities. They want to strengthen and improve the system as a whole. It's not just about their own individual programs. And that was great to see. And then overall, a desire to grow. So childcare professionals were wanting it in various formats for different experience levels. That came through loud and clear that those veterans that have been in the field a long time, they are grateful that we and others are providing opportunities for foundational level training, but they want to grow also. And I think that that is a positive through these findings. They want it accessible and relevant to tailor to meet the learner where they are, and they need opportunities to collaborate. Those in the field have an immense amount of knowledge and expertise that they can share. So, how do we raise them up to be part of this problem-solving effort that we're putting together here? So, what are their needs? So, we offered a variety of topics and had them choose what matters most. A lot of folks chose all of them because they are all important. But teaching and instructional practices were at the highest level. And then family and community engagement and leadership and program management were the next. It was interesting, scattered across, there were the other categories that we have heard, and not just now. I know when Spark did their professional development survey, we had done things within just local areas, financial stability, policy advocacy, how to retain staff, how to get enrollment up. All of those have always been something that they were interested in, but they were just put as others here. And so I think that that's just really important that we acknowledge that and see what we can do in order to support them. The top learning interest, and unfortunately, teacher burnout prevention was raised as the number one learning interest that they have. These are just various topics that we put out there to really prime the pump for their thinking of what they feel like they need. And teacher burnout and then challenging behaviors and trauma-informed care rose to the top pretty quickly. Those again came through with folks choosing overarching topics as far as social emotional learning, positive behavior support, and play-based learning. Again, this is from only 110 providers across the state, so I would be interested to learn more as we um, work in various communities for folks that if these are still what as a state that they're looking for, or if this is more in local areas, but that does bring to the top of that mental health stability for not only the childcare professionals themselves, but the staff that they're supporting. We know that they've been through a lot, and so I see that as being a very high need. The type of training preferences was shared. And so we offered these options as far as the modality and then the length that works best for programs. And as you can see, they're all pretty much warranted. We had a lot of folks that were saying, I want to click all of these. These are all important to me, and I will take professional development as it's available. And then there were the no preferences. They're just I need something. I think the in-person goes back to that quote at the beginning that said, 2 hours for an in-person training. I want in-person, but if it's 2 hours away, then that doesn't work for me. So how do we make this in-person available across the state in ways and at times that fit in a professional schedule? The live webinar and hybrid options, folks did comment that the hybrid is good for if they think they can come in person, but then there's weather or traffic or a late pickup that they can still log in and still get that training. And then length. We know that sometimes it's easier to offer things on a Saturday, but that is their personal time as well. So we asked about the preferred length or type of training. And again, the majority said that 60 to 90 minutes is their preferred length. And then it also depended on topic in the training series. As many trainings, it just an hour, 90 minutes doesn't give you enough time to dig in. So I think that that is a flexibility that childcare professionals want to have, that they can do it in various settings, but knowing that they have limited time, that 60 to 90 minutes is definitely the preferred length of time. And so we just combined those barriers to participation, lack of knowledge of where to find trainings and who provides the training and the location. Childcare programs have little or no budget, and we saw that directly from those results. professional development delivered at inconvenient times for childcare professionals, or it's too far to commute, and then too many other critical challenges that prevent this as a priority. Um, I would be reluctant to say that any of us on here may be surprised at these barriers, but it's confirming the things that we know that are standing in the way of childcare professionals accessing professional development right now are pretty important. And which one raises to the top? I think we did get that in several comments that there was concern that the survey was even going out, that professional development was not at the top of their list, and this was not a good use of resources and our time as well. So none of those are a surprise, but I think it is important to share because this is what we need to try to figure out how to bust. And then we did ask some other open-ended questions since we had them, just of our overall needs. Um, this one here from Southern Indiana, we had adjusted our services based on the subsidies we previously received, but without that assistance, we are now losing thousands of dollars each month. Parents are frustrated, children's behaviors have become unmanageable. Teachers are finding it difficult to teach due to frequent outbursts and violent behavior. And additionally, parents seem to have little interest in their education or behavior. And so, what I feel from that is frustration, uncertainty, and knowing that financially this is causing barriers in other areas. It would be just, I would be remiss to say that it's just the subsidies, but it's just the whole picture. And I think that is what I felt when I read that. Um, the lack of communication, I feel that everyone has a different answer when someone goes to ask questions. It'd be really nice for everyone to be on the same page. And I think as someone who we receive calls, and those of you that work with childcare professionals and programs, I'm sure that you feel that as well. Speaking to providers directly, it is a navigating, it's a flow chart. And who do we call for what? And when we get to that person that we think we're calling is the right place, but they say they can't help me, then I get given another number. And how frustrating that must be while people are running a business and trying to make sure families can stay enrolled. And then a director in Northern Indiana said, as a provider, I'm carrying the financial and emotional weight of these cuts while trying to keep families supported. What is being lost is not just funding, but stability, dignity, and opportunity for the families and children who depend on the system. And so we felt it was really an opportunity to at least give them an avenue, even if it was just responding to a survey, to be able to express their frustrations and what they felt it was important that we knew. And I hear it loud and clear. I'm not going to fix it. Childcare Answers, it's not going to fix it. But we have to be thinking about what we can do as a group to support this overall. And then this one I'm going to let you read on your own because you've been listening to me um, just about some of the ongoing reductions. So I think for most of us, we are a part of the early care and education world in some form. And in our past lives before this current day right now, we may have been in the provider's shoes. We may have had our own program. We may have worked in this childcare system for a long time. And just knowing that we are at a place that is new and an unfortunate place, we have to figure out how we can support not only the people that are doing the work, the families and the children that need early care and education, but then also those who are making decisions um, that are affecting in such a massive amount of for funding, communication, support, resources. We have to help support that. And then we did ask the question if your business is at risk of closing in the next 12 months. And so I know Early Learning Indiana had put out a survey a couple times and that previously. And again, this is only from 110 folks, but just to see that almost 14% of 110 people we're at risk in the next 12 months of closing. That in of itself paints a grim picture. And then the fact that many are unsure. So I think we need to also be looking at this, not only what professional development can be offered to feed those who are caring for our children, but then also how does that look when it comes to the PD around business? Is it financial? What can be done? How can people step in and support? And then how do we continue raising that up to those that are making decisions? One thing I wanted to share is just what I was a quick band-aid that we were trying to do here at Child Care Answers. We started just featuring, we have a page on our website, a PD Hub, and we have just been pulling professional development opportunities that our staff finds, that we hear about, people fill out our request form, and we are just featuring them on our website. When we were working with providers across our former child care resource and referral area, the biggest thing was I don't know where to go and I don't have time to look up and find where all of these professional development opportunities are. And so we had some interns and Kristen, our marketing and communications and data manager, helped us pull together just something in an easy format that hopefully we could drive professionals to find different opportunities. And so over since May, when then we launched this, we've had about 500 views and then 144 distinct users, meaning 144 different people have come to this page. And again, there's the featured trainings. We try to highlight things that are like the most recent or ones that may be available for a larger group to participate in. And then we have in-person and live webinars. Right now, we're not really featuring anything that's asynchronous because we've heard so loud and clear that people want that engagement. And so this is something that we have just done, not that we were asked to do or anything of that nature. We just saw a need. And so we pulled together some resources and continue to do this until if it's no longer needed, that's fine. But this for us was a way to meet the immediate need and try to get providers to have some of this in an accessible way. So I'm going to stop talking and I would love to listen to you all about what suggestions you all have for improving professional development and how can it be more accessible, relevant, and responsive. Um, Not only that, and because I'm going to stop sharing my screen, but also takeaways, because I would like this last half of the hour that we have together to be a conversation. What are the things that surprised you? What confirms what you already know? And what you would take back to your organization um, as you all try to help support and problem solve? And at the end of the day, how can we all work together to get professionals what they need in a timely manner? So I would welcome you to come off mute and let's just have a conversation.